Thyroid and antithyroid drugs are used to correct either a thyroid excess, hyperthyroidism, or a thyroid hormone deficiency, hypothyroidism. Thyroid drugs may either be synthetic or natural and may contain T3, T4, or both. Thyroid hormones affect protein and carbohydrate metabolism, stimulate protein synthesis, promote the body's generation of glucose, and increase the use of glycogen stores. Levothyroxine, Synthroid, is the drug commonly prescribed to treat people with hypothyroidism. Use this drug with care with people who are older, with heart and vascular problems. Watch for adverse effects such as nervousness, insomnia, tremor, fast heart rate, palpitations, and chest pain. Report any of these issues to the doctor right away. Adverse reactions include diarrhea, abdominal cramps, weight loss, increased appetite, the heart adverse reactions we discussed, headache, tremor, insomnia, nervousness, fever, heat intolerance, and menstrual irregularities. Synthroid should be given on an empty stomach and no other medications or food. You should wait at least 20 minutes before eating or taking other medications. It should be taken with water, not coffee, soda, tea, etc. The medication should be taken exactly as prescribed and at the same time of the day, preferably in the morning before breakfast. Don't use other drugs, over-the-counter products, or herbal remedies without first talking to the doctor or pharmacist. Diabetes is caused by a disturbance in the carbohydrate, protein, and fat metabolism, which increases glucose levels in the body. The medication used to treat diabetes assists in lowering the glucose levels in most cases. There are two types of diabetes. Type 1, previously known as insulin-dependent diabetes mellitus, and Type 2, previously known as non-insulin dependent diabetes mellitus. The person may be using insulin, oral diabetic medications, or a combination of both. The most important thing to remember when taking care of a diabetic person is to recognize the signs and symptoms of low or high blood sugar and respond quickly and appropriately. Remember, signs and symptoms of low blood sugar may include confusion, sweating, weakness, dizziness, headache, hunger, irritability, changes in speech, hearing, or vision. Be sure to have them immediately check their blood sugar using their AccuCheck. If it is low, give them something with sugar. If they are conscious and able to swallow, follow it up with a complex carbohydrate and a protein, like peanut butter and crackers, with a glass of milk. If they are unconscious, call 911. The flip side is high blood sugar. Frequent urination, sugar in the urine, excessive thirst, and when the levels are very high, the breath smells similar to juicy fruit gum. If you notice any of these symptoms, have the person check his blood sugar. If it is high, contact the doctor for instruction. If they are unconscious, of course, call 911. Very low blood sugar and very high blood sugar are life-threatening. Through careful monitoring of blood sugar levels and following the prescribed treatment, these life-threatening circumstances may be avoided. Insulin is used to treat type 1 diabetes and type 2 diabetes when other glucose methods have failed or are contraindicated. It is also used when glucose levels are elevated due to emotional, physical stress, or when oral medications are contraindicated because of pregnancy or hypersensitivity to oral medications. It is also used in the hospital to treat DKA, which is diabetic ketoacidosis. It is especially important to avoid delays in the person's mealtimes to prevent low blood sugar if he is being treated with insulin. When you are caring for a person that is being treated with insulin, it is important to remember unlicensed direct care providers may not prepare syringes or administer or supervise insulin administration. Insulin relieves the symptoms but does not cure diabetes. Blood glucose monitoring is essential. Don't skip meals. The accuracy of drug measurement is very important. The person or his family should not alter the order in which the insulin types are mixed. The person should not change the brand or syringe or needle used without first talking to the prescriber. Know the signs and symptoms of low and high blood sugar and what to do. The person should wear or carry medical identification at all times. Oral diabetic medications stimulate the pancreas to release insulin in a person with a minimally functioning pancreas. They also provide several actions outside of the pancreas to decrease and control blood glucose. Oral diabetic medications can work in the liver to decrease the glucose production that occurs there. They can also increase the number of insulin receptors in the tissues, which provide more opportunities for the cells to bind sufficiently with insulin, which initiates the process of glucose metabolism. Remember, anti-diabetic drugs will relieve the symptoms and signs of diabetes, but they do not cure the disease. By following the prescribed therapeutic regimen, adhere to a specific diet, weight reduction, exercise, and personal hygiene programs, people can live long and healthy lives. Oral anti-diabetic medications have several classifications. We will look at each of them and the adverse reactions to watch for. Remember, hypoglycemia or low blood sugar is always an adverse reaction you should be prepared for. Typically, hypoglycemia results from too little food or too much medication. This reaction can also occur after an incorrect dose or more likely from drug or metabolite accumulation in the body. Sulfonylureas include glimepiride, glipizide, glyburide, and glinase. Sulfonylureas lower blood glucose in people with type 2 diabetes by directly stimulating the release of insulin from functioning beta cells in the pancreas. They are only effective in people whose pancreas is capable of producing insulin. Adverse reactions to watch for include low blood sugar, epigastric fullness, nausea, low sodium, water retention, photosensitivity, and rashes. Thiazolidinediones, which include actose and avandia. Thiazolidinediones bind to receptor cells and fat cells and promote the maturing of the fat cells and deposition of fat into peripheral tissues. By reducing circulating fat concentrations, they improve a person's sensitivity to insulin. They may be used alone or in combination with other oral diabetic medications, such as Metformin or Sulfonylureas. One of the medications in this group has recently been linked to heart disease. As a result, drugs from this group are generally not recommended as the first choice in treatment. Adverse reactions to watch for: swelling and weight gain. Glucophage and metformin. Metformin reduces the amount of glucose your liver releases into your bloodstream. It also allows your body to respond better to insulin. Metformin does not cause weight gain, unlike some of the other diabetic medications. Metformin may also be prescribed for polycystic ovaries and metabolic syndrome. Adverse reactions to watch for: low blood sugar, especially when taken with several over-the-counter or prescription drugs, such as Tagamet, Zantac, procainamide, Procardia, and vancomycin. IV contrast media reactions, can lead to lactic acidosis in people who have renal impairment. Abdominal discomfort, metallic taste, nausea, and vomiting. Combination drugs include Meglitinides, which is metformin and glipizide, Glucovance, which is metformin and glybuteride, Avandimet, which is metformin and Avandia, Actos-Met, which is metformin and Actos, Prandimet, which is metformin and Prandin, and Janumet, which is metformin and Januvia. Lactic acidosis is a rare but potentially fatal condition that is a potential adverse reaction when taking metformin. The risk is increased in people who have impaired kidney function. Expect a doctor's order to hold metformin in people with any condition that is associated with low oxygen levels in the blood, sepsis, which is a severe infection, dehydration, and people with evidence of liver impairment. Metformin is temporarily held when the person is scheduled for an X-ray procedure requiring IV contrast media, undergoing surgery, or any procedure that may decrease the function of the kidneys. Be sure that the healthcare professionals providing the tests or procedures mentioned previously are aware that the person is taking metformin or a combination drug that includes metformin and the time of the last dose. If the doctor orders any medication to be held for a procedure and you forget and give the medication, call the doctor's office right away to reschedule the procedure and fill out a medication error report. Neglecting to notify the doctor and rescheduling may result in serious injury or death for the person. Alpha-glucosidase inhibitors. Examples are arbacose and meglitinides. Alpha-glucosidase is one of the enzymes responsible for breaking down carbohydrates into simple sugars like glucose. Alpha-glucosidase inhibitors work by slowing the digestion of carbohydrates and delay glucose absorption. This results in smaller and a slower rise in blood glucose levels following meals and throughout the day. Adverse reactions to watch for include low blood sugar, abdominal pain, diarrhea, and gas. Meglitinides. This group contains Starlix and Prandin. Meglitinides work by stimulating the pancreas to release insulin in response to a meal. This group of medication works quickly, therefore the medication should be administered 30 minutes or less before the meal is consumed. It is extremely important that the person does not skip meals when taking this medication. Skipping meals put them at risk for low blood sugar. There are several medications that interact with this group of medications. Be sure that the person takes a current list of all prescribed and OTC medications and supplements he or she is taking whenever they go to a doctor's appointment, the emergency room, or an urgent care. Reactions to watch for are low blood sugar, upper respiratory tract infection, and weight gain. You are caring for Savannah, a 32-year-old female with Prader-Willi. She has recently been diagnosed with type 2 diabetes. You notice that she is sweaty, irritable, weak, and is complaining of a headache when she gets home from the ADD. What do you think is wrong, and what should you do? Perfect. Savannah is sweaty, irritable, weak, and is complaining of a headache. These are classic signs of hypoglycemia, low blood sugar. You are taking care of David, a 32-year-old male with Down syndrome. He has had an upper respiratory infection and the doctor ordered prednisone in addition to his routine inhaled corticosteroids. He has been urinating more than usual, is thirsty all the time, and his mother states there was sugar in the urine when she did the urine dipstick. His breath smells like juicy fruit gum, but he is not chewing gum. What do you think is wrong, and what should you do? Perfect. David is urinating frequently, is excessively thirsty, and has sugar in his urine. His breath smells like juicy fruit gum. These are classic signs of hyperglycemia, and he may have diabetic ketoacidosis, DKA. This is potentially a life-threatening situation, and must be evaluated by medical professionals.